Hi, I'm Dr. Meaike. I'm one of the upper extremity hand surgeons here at Orthopedic Institute, so I treat shoulder to fingertip.
My name is Chad Harms. I am one of the hand therapists here at Orthopedic Institute.
Yeah, so probably three of the more common things that I see when people come in with elbow problems would be cubital tunnel syndrome, kind of numb tingliness in the ring finger and small finger, but also some inside of the elbow or medial elbow pain. Also, lateral epicondylitis, tennis elbow is kind of the common term. So pain on the outside or thumb side of the elbow, especially with use and activity. And then olecranon bursitis is a pretty frequent elbow diagnosis that patients will come in with. And that's pain and discomfort right over the tip of the elbow with a pretty big fluid collection or localized area of edema that can be pretty painful and limiting.
Again, kind of a golf ball, you're just trying to get your swelling down through that. So we're hoping it's going to be kind of a quick and easy treatment for something like that, but this arm sleeve that we utilize is going to be a good option for it. There's definitely some different options that you have out there, but this is the one that we prefer. You're really trying to get the right amount of compression. If you have too much compression, that can cause an issue. If you don't have enough compression, that can cause an issue as well too. Dr. Meaike was discussing where you can sometimes get the numbness and tingling in your small finger as well as the side of your ring finger. So then we're more concerned about the nerve down here in the elbow. A big issue that people are going to have at night is the ability to bend the arm too much and it actually stretches the nerve over the elbow. So we get into something like these. It can actually stop it from bending too much. So it actually protects the nerve a little bit as well as making sure that it doesn't bend and stretch the nerve. The reason why we like this is because you can actually take out these little metal bars that help it stay in place at night. And then during the day, depending on what you do, it can actually work as a nice thick gel pad here and actually protect it as well too. With a lot of these different things that we discuss, if people get the wrong size, it can create too much compression in certain areas and cause more problems than what it's actually doing to help out. So you want to make sure that you get a good therapist that can tell you how to wear it and also when to wear it too. There's definitely a time and place for everything. We'll do a lot of therapy on the tennis elbow, but doing something like a tennis elbow strap, a lot of people might come in and we're discussing things with them and they say, hey, you know what, I got one of these straps. I went down to Walgreens or Walmart or something. The reason why we like this or we like you coming in to be able to discuss these things is it's making sure it's the right size, making sure it's the right style. And a lot of times we'll get people that come in and you need to know how to apply it. So if you get something that's too narrow, it can end up basically being a tourniquet on your forearm. If you put it on the wrong spot, you have 3 different nerves that are essentially running down into the forearm that you can create too much compression on the nerves, and sometimes it can make your symptoms worse versus better. Just because this is an option does not mean that this is appropriate for everybody. So we have this and we have other options as well too. And that's a great part about coming in and seeing physician therapists is we'll be very upfront with you saying, hey, it might be a great option, but you know, we have some other options as well too.
Yeah, I think one of the things that makes Orthopedic Institute special is just our patient-focused approach. And then having this close relationship with a surgical provider and non-operative management with occupational therapy, but especially after surgery, our ability to be down the hallway from one another, the ability to, if you're having questions or concerns, we can just easily communicate back and forth live as we're examining a patient together to optimize an outcome, especially with hands and wrists that get swollen and stiff and can require pretty complicated rehab protocols. Just that easy, clear, immediate conversation to help patients improve and get back to where they want to be and need to be, I think gives them the best outcome possible. Get relief, move better, live stronger.